Okay, yes, this story is about poop, but I guarantee it's not your regular story about poop. So I'm like probably like 3 or 4 months off orientation as a new grad in the liver transplant ICU. And for those that don't know, liver failure patients are prone to a lot of bleeding. Your liver actually controls most of your clotting factors. Your liver does a lot. I won't get into it, but your liver does a lot. And what you need to know right now is that if your liver's messed up, you're bleeding a lot. And I'm talking like you can be bleeding out of your mouth, you could be weeping in your arms, you could be bleeding in your intestines and have GI bleeding, and then GI bleed poops. And nurses know there is no other smell like a GI poop smell. I'm sorry, I'm telling y'all this so early in the morning. I'm sorry. Anyways, my liver failure patients, I have two of them. One has family in the room, like their husband and their son. They're like a teenager or something. So visiting hours end at 8. I get in at 7. So I go check on my other patient. I let them, I introduce myself, but I let them spend as much time as they can with their loved one before visiting hours end. So I'm in the room with my other patient. I'm doing my assessment, just like really just starting my shift. Great start to the shift. And as I'm assessing my patient, the son comes and knocks on the door and they're like, "Excuse me, um, I think my mom is bleeding." And I'm like, "Okay, I'm coming right in. Drop everything, go over next door." She pooped blood. So much blood. So much bloody poop. It was dripping down the bed, off the sides, onto the floor. Huge puddle of just bloody shit. And I'm like new, okay? I'm new to this. And I'm like, I look at her, I look at the floor, I look at her. And then her son is like, is this normal? Hold that thought. I mean, is it normal for liver patients to have GI bleeds and GI bleed poops? Yes, but is it normal for it to be dripping on the floor? Not necessarily.